Welcome to MLT Case Study Series 5. In today's case study, we'll discuss about von Willebrand factor disease. A brief introduction. This case study explores the journey of diagnosing and managing von Willebrand factor disease, the most common inherited bleeding disorder, yet often underdiagnosed due to its wide spectrum of presentation. We delve into the intricacies of von Willebrand factor disease, emphasizing its impact on patient and the importance of accurate diagnosis and personalized management. I just want to tell one more thing. Von Willebrand factor disease is one of the most asymptomatic disease and misdiagnosed disease. So mismanaged and misdiagnosed misdiagnosis of von Willebrand factor disease leads to an underdiagnosis causing significant and needless morbidity in the patients. That means they have increased chances of further disorders due to ongoing von Willebrand factor disease because we are unable to identify this disease in the patients. It is one of the most asymptomatic and underdiagnosed disease as I stated. So objectives of today's case study, what viewers will learn, they will understand about the genetic and physiological underpinnings of von Willebrand factor disease. They will recognize the diverse clinical manifestations of this disease. They will understand the critical role of lab in diagnostics in identifying this disease, and they will understand the approaches to manage and treat their patients and their outcomes, and they will understand the importance of awareness and education in improving lives of those with von Willebrand factor disease. So, in order to understand von Willebrand factor disease, you must understand what is this hemostasis. So, I will show a brief introduction about hemostasis. So, whenever this is the blood vessel, so whenever the blood vessel damaged, the collagen will be exposed. The collagen fibers will be exposed. Now, this endothelial cells will release von Willebrand factor. Okay, von Willebrand factor. Now to this von Willebrand factor, the platelets will attach, and platelets will eventually they will attach, aggregate, and they will prepare a platelet primary plug. So the bleeding will be stopped. But in case of von Willebrand factor disease, this von Willebrand factor will be deficient, leading to an excessive bleeding disorder. Leading to an excessive bleeding disorder with clinical symptoms of easy skin bursting, skin bleeding, increased menstrual bleeding, increased internal bleeding, and also some of the important lab tests include the platelet count will show mild thrombocytopenia can be seen, and normal PT and INR might be seen, and normal APTT can be seen. That means the clotting coagulation factors will looks normal even though there is a bleeding. So that is the thing, and let's see how this will be done. And in the patients who have this von Willebrand factor disease, they can be treated with the help of a drug called desmopressin. So desmopressin will act as a compensator drug molecule to replace the von Willebrand factor in the patients who are affected. So today's patient's background. So the patient is 25-year-old female. The initial presentations include recurrent nose bleeding, prolonged menstrual bleeding, and history of excessive bleeding after dental extraction has been seen. So relevant medical history, family history of bleeding disorders, personal history of easy bursting, and prolonged bleeding from minor cuts has been observed in this patient. Clinical presentations. The clinical presentations include detailed account of bleeding episodes, including menstrual bleeding, and incidence of spontaneous trauma has been seen. And this patient also been observed for presence of petechiae, purpura, and ecchymosis. So what is this three? So these are the rashes on the skin we'll see due to bleeding under the skin. Due to internal bleeding, we can able to see either petechiae, purpura, or ecchymosis. Ecchymosis is the very late form of internal bleeding. So this can be seen. And the diagnostic approach. So initial screenings included CBC to check of any signs of anemia which might be caused by prolonged bleeding, and platelet count to rule out thrombocytopenia. And we performed bleeding time. Though not specific to this test, but a prolonged bleeding can indicate a potential issue with platelet function or interaction with the blood vessel wall, which is relevant to von Willebrand factor disease. Then clotting time. Clotting time will provide a detailed assessment of clotting ability of blood. Prolongation might suggest a coagulation pathway issue. And coagulation profile, including PT, APTT, and PT usually normal in von Willebrand factor disease, while APTT can be normal or slightly prolonged due to the role of von Willebrand factor in stabilizing factor 8. So the follow-up tests with a specific diagnostic test based on the initial findings, especially if they suggest a possible diagnosis of von Willebrand factor, the follow-up test can be very crucial. That includes measurement of von Willebrand factor in the blood, von Willebrand factor antigen in the blood, and von Willebrand factor activity with the help of ristocetin cofactor activity test, assessing the functionality of von Willebrand factor in the patient, and factor 8 activity levels. Since von Willebrand factor stabilizes factor 8 levels, can be reduced in von Willebrand factor, and von Willebrand factor multi-timer analysis. So providing information on structure of von Willebrand factor, which can be helpful in distinguishing between different types of von Willebrand factor. So these are the tests that we have performed, and the lab results came like this. The presentation of von Willebrand factor antigen and activity levels, and factor 8 activity and multi-timer analysis with findings. And so the differential diagnosis that we opted in this patient include clotting factor disorders such as hemophilia A and other clotting factor deficiencies, and acquired von Willebrand factor syndrome such as medications. So the final findings of this particular patient has been like this. After initial screening and specific tests suggested the presence of a bleeding disorder, detailed von Willebrand factor analysis and genetic testing were undertaken. These tests confirm that diagnosis of von Willebrand factor, identifying the specific type of based on von Willebrand factor antigen levels, multi-timer pattern, and genetic variation. So the treatment of von Willebrand factor is tailored to the type of von Willebrand factor diagnosed and the severity of the symptoms. The patient's treatment strategy included giving desmopressin, that is used to stimulate the release of von Willebrand factor stored in the body, effective in mild to moderate cases of type 1 von Willebrand factor disease, whereas von Willebrand factor 8 concentration infusions administered to replace the deficient factor in more severe cases, or in situations where the desmopressin is ineffective, and antifibrinolytic therapy. So the patient is employed to prevent the breakdown of blood clots, useful in controlling mucosal bleeding such as heavy menstrual bleeding or dental procedures. So the outcome: following the implementation of this treatment regime, the patient experienced a significant improvement in bleeding symptoms. So the success of the treatment highlighted the importance of a personalized management plan based on the specific type and severity of von Willebrand factor disease, regular monitoring and adjustment of therapy to ensure optimal control of symptoms, education of the patient on managing bleeding episodes, and the importance of follow-up care. This comprehensive approach to diagnosis and management not only improves the platelet quality of life but exemplifies the nuanced care required for individuals with bleeding disorders like von Willebrand factor disease, underscoring the critical role of accurate diagnosis and tailored treatment plans. Thank you so much.